Namaste. My name is Jaya Daptardar, and today I am going to talk about prenatal care, Garbha Sanskar in Ayurveda. I'm Ayurvedic doctor and also healthcare executive. I have my herbal wellness program, and I have published 3 books so far: Aging Gracefully, Be Beautiful Inside Out, Ayurveda's Wisdom for Management of Pain and Addiction. My email is jmdaptardar@hotmail.com, and my website is www.ayurbeautyandlifestyle.com. So, our today's topic is very popular nowadays: prenatal care. So before we talk about that, I just have a little disclaimer here that the sole purpose of this presentation is to provide an educational information about Ayurveda, and this information is not intended for use of treatment or cure of any disease. If you have any serious, acute, or chronic health concerns, please consult your family physician or healthcare provider who can fully assess your individual needs and provide the care you require. So, let's talk about Garbha Sanskar. For the woman to become pregnant and go through the 9-month cycle and give birth to a baby is a beautiful thing in the universe, in her life. So, Garbha Sanskar, the sanskaras are given for the unborn child, are equally important as the care, the care that's provided to mother. So, what is Garbha Sanskar? Garbha means fetus, and Sanskar means educating the mind of that fetus. So, Garbha Sanskar is the effort for enhancement and betterment of the fetus, mental and intellectual development of that unborn child. So, Garbha Sanskar actually means the molding of this unborn child. It's like a clay. So you're reforming, polishing, ultimate molding and cultivating the unborn child. It is the same thing even after the child is born. You have to teach the child how to talk, how to walk, how to behave, and what education you're going to give it to this child, the sports education or extracurricular activities, or the social interaction. So what you are doing is to mold the child. So the same thing for the unborn child. And it can be defined as a developing an educated, civilized, and cultured, and a responsive child, plus physically, spiritually, and mentally steady child. So this is basically the quality that you want in your unborn child. You need to give the Garbha Sanskar through the techniques. There are techniques for these care. So, Garbha Sanskar is the way of particular efforts taken to encourage baby's senses tenderly for the most development of its physical and intellectual capacity. So, why should we do prenatal care, this Garbha Sanskar? You have noticed that nowadays 80% of the children have some kind of issue, um, whether it's anxiety, depression, or social phobia, or ADHD, um, or the kids are very hyper. So why this is happening? Because these sanskaras are not given during the pregnancy. The mother, the care of the mother and the fetus both are equally important at that time. And if that doesn't happen, the mother is stressed or mother is anxious. All these things flow into the unborn child. Um, so now people are more getting aware of this Ayurveda's Garbha Sanskar procedure, prenatal care procedure, and they're willing to learn from the Ayurvedic doctors. They're willing to enroll in the Garbha Sanskar classes training. So it is very much necessary for the healthy and spiritual growth of the baby, mental and intellectual development of the baby. Doctors can do ultrasound every month to find out and measure the physical growth of the baby. Doctor can see the mother every month to find out mother's physical progress. But we cannot find out the behavior of the unborn child, the development of the intellectual of that unborn child. We cannot measure the spiritual growth of the baby. How we can do this? By the experience and how the mother feels the moment and the response of the baby when she talks to the baby or when she touches the tummy. So these sanskaras are important because the child with issues or the problems are the problems for the generation. They're the problem for the society. It destroys the peacefulness of the family. So it is a duty of every family. It is not just the parents, the whole family of both the parents to make sure to learn what the process is and emotionally and socially help the future parents to nurture that unborn baby. So Garbha Sanskar leads to a happy mother equal to happy child. So taking care of mother is very important during that time, because when woman conceives, the fetal development happens in the womb, and the cells of the fetus circulate through the bloodstream, the mother's bloodstream, and then it circulates back to the fetus. So whatever mother does, or the nutrition she gets, it gets transferred to the fetus. So mother's physical and mental health balance is equally important. So this is the data I collected from the web. It's from WHO, World Health Organization, and I believe that their latest update was 2017. This is the world. This is a global data. So what happens if the good care is not taken, the mothers and the fetus, then the maternal complications happen. 35% of them are postpartum hemorrhages due to the stress, malnutrition. And I understand that genetic factor is also important. Mother's health condition is also important in this. Then the hypertension, 18%, because stress is the bigger part in this hypertension, gestational hypertension. Sepsis, 8%, abortion, 9%, and the other direct causes, 11%, embolism, 1%, indirect causes, 18%. So this Garbha Sanskara and how it affects, there are stories, epic stories, and there are a lot of recent, that means not in this century, but the past century, when there were the kings and the queens. So why the queens used to tell this various stories to the fetus when she was pregnant, and why there were rituals of celebrating the pregnancy with the women and the family, telling the stories that they want the fetus to listen, the songs, then taking pregnant women to the a beautiful environment near the water, where the calmness is, flower gardens, to watch the animals, all these things, just to enhance the quality. So this is the epic story of Abhimanyu in Mahabharata, when he listened to a story of Chakravyuha when he was in Subhadra's home, and he learned how to enter into the Chakravyuha. But obviously, the story is Subhadra slept, and the half story was grasped by the fetus, and the other half wasn't. So Abhimanyu only knew how to enter into the Chakravyuha. So, but besides that, there are a lot of stories of the people, like musicians. Their kids become musicians. Why? Because they hear that music and those stories during the pregnancy. The mother listens. And when the mother gives the Garbha Sanskar to one baby and gives the same Sanskara to the other baby, then both have the same personalities. But a lot of times we hear that the siblings don't have same interest. They don't have same personalities, because their sanskaras were different at that time. So Garbha Sanskaras are two types. one is preconception sanskar and other is post-conception. So it is also important to prepare the couple before the conception. So they need to be happy. They need to be healthy. So the definition of health, of course, in Ayurveda is not just the physical health, but the balance of the physical, mental, and the spiritual health of both the parents are important. And then the post-conception sanskaras. There are the techniques used after conception for the baby's enhancement and growth. So, good mind and body health of the couple is important before conception. So, the theory of suprajanan or best reproduction in Ayurveda is important because it refers to this preconception sanskara. It includes the training of the couple for the preparation of pregnancy 3 months before the conception. Pregnancy should not be by chance. It should be by choice. It should be a joyful process for the parent. The commencement is by pindashuddhi, or the cleansing of the gametes and ovum. So this is not like cleaning something. The cleansing is the panchakarma for both the parents. So their body is free from toxins. If the couple is not in the condition of mental steadiness and peace, even if they are actually fit, they cannot give birth to a healthy child. So the mental peace and steadiness, sattva guna of mind, is directly associated to one's food habits, lifestyle management, and numerous other factors. So this couple has to follow the whole lifestyle management as well, to eat sattvic food for the sattvic mind, and do exercise to keep the health, keep their health, keep themselves healthy, for the healthy sperm and ovum. So during that 90 days time, the couple has to make sure that they're not stressed at work, they're not anxious, they're not rushing, they're not working day and night. So they are basically happy. And due to this globalization, everybody is in a rat race. So for that period of time, they have to make sure that they follow the lifestyle, the pre-samskara lifestyle for the planning of the baby. So when this purva sanskara, the pre-sanskara, the pre-planning for the baby happens, the first thing is to do the prakriti parikshanam. That means the evaluation, the Ayurvedic evaluation for the couple, genomics, to find out if there are any imbalances to balance ahead of time. Rajaswala paricharya in female, that means care of the woman during the menstruation is important. So she should take rest. She should not be stressed. Follow the food regimen. This is a tool to enhance fertility. Shodhana in couple, panchakarma, that is the shodhana. Then ahara shuddhi, the special food planning that I said. Then vihara shuddhi, special daily routine of the exercise, yoga and all. Brahmacharya, complete celibacy. Why? Because in that time frame, they have to gain and develop more ojas in the body to produce the healthy, sperm and ovum. Nadi Shuddhi, pranayam, yoga kriyas are important at in terms of Purva Sanskara. Agnihotra is also recommended. That means a yagya. So it does the fumigation. It cleans the environment ahead of time. So why these Purva Karmas are important? Because you don't know the time in between these 90 days process and the conception happens. Because when that happens, the development of brain starts right away. So they have to continue this lifestyle management. The brain starts to show its presence as early as 5 weeks of pregnancy. So in 36 weeks, the development of brain is complete. After these 90-day protocol, if the conception occurs, they have to follow the monthly lifestyle routine and patya apatya, because in first trimester, the certain type of food is not recommended. The too much spicy and pitta type of food is not recommended, because the first trimester it's a delicate period for the mother. And then there is a monthly lifestyle to follow. Every month, it's recommended for the pregnant woman to drink milk, the cow's milk, because milk prevents from the dehydration and supply the nourishment. And then every month increase the milk with madhura rasa, then the milk with honey and ghruta, panchamrit milk, and from 5th month, eat more ghruta, ghee. Then in 6th, 7th month, gokshura is added, a diuretic is added, so it prevents the retention of water and the complication. So, and then in 9th month, actually, Anuvasan Basti, the administration of the medicine in the form of oil in the body through it's actually enema, but through the vaginal route is recommended in Ayurveda, just to prepare the nervous system governing the myometrium. It helps in regulating the function during the labor. So that is also included in the sanskaras. So these all sanskaras are beneficial for mother, for baby, and for the society. So there are the Garbha Sanskara techniques besides the food regimen and the other checkups. So the first part is the informative lectures and training for the parents to educate and the family. Dietary advice according to Ayurveda in first trimester, second and third. Then the regular checkups, exercises. These are the different exercises during the pregnancy, not the regular exercises, according to even body type and the capacity of the pregnant woman. Yoga, pranayam, Vedic sanskaras are important. Those vibrations of the sound of the mantras enhance the growth of the fetus and their mind, spirituality. Garbhani upachara, if the pregnant woman develops any imbalances, then there are herbal remedies for that too. Garbha Sanskara training also involves counseling on regular basis for the parents. These trainings are offered 2 times in a week, or sometimes one time in a week. It depends on their schedule, but they can follow at home regularly. So for the fetus development trainings, deep breathing exercises are recommended. Garbha Samvad is the very popular one. Talk to baby all 9 months, and there is no such rule when to start these Garbha Sanskaras. You can start anytime. If you don't have time, start in the last 3 months. Touching tummy is good for the sense of love, a deep relaxation, listening to good music and mantras. Like I said, mantras and musics have a different vibrations that impact the fetus development. Happiness is very important. The effect of stress on expectant mother and fetus is not good for the development. So whatever makes them happy during the pregnancy is important. So types of activities for Garbha Sanskara, we said in the previous slide, Garbha Samvad, breathing exercise or Omkar, reading good books, keep yourself and family engaged in positive talks. Dhyana, Jyoti Dhyana, or any type of Dhyana for increasing concentration. Any hobbies, if the parents have painting, singing, gardening, knitting, or listening to the songs, those are good for the development of the intellectual development of the fetus. Yoga and pranayama, of course. Garbha Samvad has a very huge benefit for the development, the maximum development of the fetus. So effort taken to stimulate baby's senses gently so that the cortical development is maximum. So there are a lot of benefits of listening to music, different types of mantra, chanting, make a nasal sound because it produces nitrous oxide, which is good for the happiness. There are a lot of observations also needed during that time, just to make sure the baby responses. That's kind of measuring good moral behavior, good capacity of retention, good memory, that if the fetus memorizes the touch or the sound. So basically you're making a designer baby, the qualities that you need in your baby. So let's facilitate the formation of a culturally rich generation. And wish you all a healthy and intellectual baby if you are planning for the pregnancy, or you are pregnant. Otherwise, wish you all a healthy and long life. Thank you.